Hi, I'm Prof. Ben and we're going to talk about breast awareness. It is October, Breast Awareness Month, and we are going to remember the importance of breast health.
Prof. Ben, why is breast cancer awareness so important? With it being October, we've heard so much from many different media organizations about the importance of breast cancer awareness and breast health, but from a leading expert in her field, what can you tell us about this?
So I think taking times or days and using them as opportunities to remember the importance of, for example, women's health or breast awareness or breast cancer is important, but it's that calendar reminder. It's like going to the dentist once a year. What we must not forget is that these are diseases, breast cancer, that happens every day of the year, and we must use it as a momentum to do a couple of things: to revisit important topics such as how do you examine your breast, remind ourselves the value of screening, inform and make aware to public people, medical professionals, the correct way and the multidisciplinary way to manage things, and basically give a thumbs up and a kudos to our patients and people who have been through a breast cancer diagnosis. And that's, for me, the importance of something such as Breast Awareness Month. So I think we should start off by the fact that breast cancer is one of the commonest cancers affecting a woman. I always say that it's neither ageist, racist or sexist. We see it across all age groups. We see it across men get breast cancer too. Hey guys, you've got boobs, okay? And we see it across all different races. So we needn't be, and we shouldn't be complacent. And what that means is we mustn't take a concept and say, well, I've done everything right, I've got no family history, I've got no risk factors, therefore it can't happen to me. So 65% of all women who get breast cancer have no identifiable risk factors. We have modifiable risk factors, things we can change. What can you change? What's your BMI? Keep your BMI under 30, preferably under 25. Diet is hugely important. Exercise, phenomenally important. It decreases cancer risk by at least 42% across the board. What else do we know is fix those bad habits. Watch alcohol, watch smoking, and again, junk foods and overweight. Okay.
That's wonderful. Thank you, Prof. That actually leads perfectly into the next question. How can I go about checking to see if I have breast cancer or more generally any kind of breast conditions? How do I go about conducting a self-breast examination? And do you have any tips about that?
Absolutely. So the first thing is you need to know your body. Your body, your friend, okay? Your temple. Doesn't belong to the doctors, belongs to you. So what do you need to do is, there's nothing wrong, I think, with standing naked in front of a mirror and having a look and see, and obviously gravity is not our friend and things head south the older we get. What I mentioned when I spoke on the radio yesterday, a lot of people don't even have access to mirrors. So sometimes and obviously we're talking politely and dignified way, a partner, a friend, okay, someone who's appropriate, is if you are naked in front of them, if you don't have access to a mirror, and what you're doing is lifting your arms to the side and checking that nothing's pulling your nipple in. So know your breasts, okay, and that there's nothing pulling the skin in. Notice 1 in 5 women have extra breast tissue on the side. This is not fat, you can't dye it away, and people can have extra nipples in the mammary line. You use the flat of your hand, 3 fingers, to examine your breasts in a circular motion or top to bottom if your breasts are big, and you do it left hand right breast, right hand left breast. Don't squeeze your nipples, but feel under your nipples. And obviously this is once you've inspected to see there are no changes in the skin or skin of the nipples. When you feel a gland under your armpit, you relax your arms carefully to the side to feel them. If you lift your arm up, you bring all the structures forward and it's less easy to examine and feel for lymph nodes. So you need to know your norm. Know your norm means if you're checking your breast once a month, you need to see if there's something different from 1 month to one. So that's why you choose either a calendar day or a week after your period. By doing that, you are getting in touch with your body. Now, it's very, very common to have breast pain. Almost everyone at some stage has breast pain. Not all of it is concerning. So if you have pain on the sides or in the middle, often associated between pain between your shoulder blades, that can be costochondritis. Now obviously we exclude things like risk factors and cardiac disease and pneumonias and everything, but I understand pain that comes and goes, and on the side is usually inflammation in the rib. Breasts, okay, hang on the pectoral muscle, so if you lift your bra up or you take your bra off and you get pain running down the sides, that can obviously be because gravity is not your friend and you've got the weight of the breast. If you get burning, shooting pain in your breast, that is often a condition called ductictasia, inflammation in the breast ducts, and we usually treat that with Bactroban. And then you get hormonal pain when your breasts feel full and uncomfortable, and that can happen before your menstrual cycle or at any stage.
Wonderful, thank you, Prof. So let's say we've been doing a self-breast examination and we have found a lump, and we check again in another month and it's either it's still there or now it's growing bigger. What should I do? Who should I present to first?
So what we need to understand is that healthcare access is a right for people. So if you have medical funding, you can see your general practitioner and ensure that they write a note, and if you're under 35, send you for an ultrasound, and if you're over 35, a mammogram and ultrasound. If you don't, you can access one of the many very good government clinics. So for example, an open access clinic would be on Tuesday morning at Helen Joseph, and you get there before 9 to open your file, and you quickly triaged and assessed. Okay, obviously around SARS-CoV-2 we ask people to be patient about waiting times, but CMJ and Chris Honey-Barra and Steve Biko in Pretoria, they will all have ability for you to see someone and be properly assessed, and I think that's important. If we are concerned about the lump, we don't rush into an operation, but we do something called a needle biopsy. A core needle biopsy is the correct way to make a diagnosis of anything, particularly a breast cancer. And then you take time to go over with your doctor and your specialist what your options are. You never rush into an emergency cancer operation. I saw a lady last who was like, they said they had cancer everywhere and it was an emergency, and they operated on my breast. If breast cancer is emergency, you're not going to die of it in your breast. So cancer kills by spreading to different places around your body, and what we want to know is there any concerns there, and to set up a multidisciplinary plan of management that may not necessarily involve starting with an operation.
Wonderful, thank you, Prof. And then, do you have any advice regarding mitigating your risks of getting breast cancer, or any other tidbits or words of wisdom for ladies out there?
So I think that's such a lovely question. So advice, okay, you can't prevent cancer, but you can decrease your risk. So you decrease your risk by exercising, watching your BMI, and cutting out those bad habits. You decrease your risk by going for regular screening, checking your body and checking your breast, and being responsible about where you go and seeking second opinions. So these are all very important factors. I think what I'd like to end on is myths. Myths around breast cancer. There's so many of them. So I was thinking about it as I was driving today. There used to be the myth that the lead in the lipstick causes cancer, and then there was one a short while ago about the lights, okay, causing cancer. Now the fact of the matter is we do see male breast cancer, but not that men wear a lot of lipstick, but with the lights we'd see a lot more male cancers. So underwide bras do not cause breast cancer, neither do putting your cell phone in your bra or keeping your money there, neither does trauma to your breast. The amount of times I see people who go, I fell and therefore I found a lump. The fall didn't cause the lump, but because you fell you were more aware of your breast, and that's why you detected the lump. So trauma doesn't cause breast cancer. So we've gone over breast cancer is basically caused by a abnormal cell line or cell growth, and the cell is affected by a variety of hits of genetic and environmental conditions. So that's why we say know your family history on your father and your mother's side, both of breast and other cancers. And I think the other important thing to do is, from a myth point of view, is discuss your myths with your doctor. I think we should myth bust lots of things, and possibly even do a full session on myth busting. Ask people to send their myths in, and then we can look at what they are and see where the fact or the fiction comes in.
Wonderful. Thank you, Prof.